Neurocognitive disorder. Cognition includes memory, language, orientation, judgment, conducting interpersonal relationships, performing actions, problem solving. Cognitive disorders reflect disruption in one or more of these domains. Neurocognitive disorders include delirium, amnesia, mild cognitive impairment, neurocognitive disorder due to general medical condition, and dementia. Delirium describes a condition of short-term confusion and changes in cognition. There are several causes such as infection, substance-induced head trauma, sleep deprivation, medications. Amnesia is a major neurocognitive disorder caused by other medical conditions. They are marked by memory impairment in addition to other cognitive symptoms. The causes include medical conditions, toxins or medications, unknown causes. Mild cognitive impairment defined as the presence of mild cognitive decline not warranting the diagnosis of dementia, but with preserved basic activities of daily living. Dementia, also referred to as major neurocognitive disorder, is marked by severe impairment in memory, judgment, orientation, and cognition. Severity specifiers. In mild cases, instrumental activities of daily life such as cooking, paying bills are impaired. In moderate, basic activities of daily life are impaired such as eating and dressing. Whereas in severe cases, there is impairment in all activities and they are fully dependent on others. Etiologies of dementia. Degenerative causes include Alzheimer's disease, frontotemporal dementia, Parkinson's disease, Lewy body dementia, progressive supranuclear palsy. Psychiatric causes include pseudo dementia of depression, cognitive decline, and late life schizophrenia. Metabolic causes include vitamin deficiencies such as vitamin B12 and folate, hypothyroidism, chronic metabolic disturbances. Infections such as prion disease, acquired immunodeficiency syndrome, and syphilis contribute to dementia. Drugs and toxins, alcohol, cognitive dysfunction due to medications such as anticholinergic and carbon monoxide. How to differentiate dementia from delirium? Memory loss, cognitive impairment, functional impairment are present in both, whereas dementia is a chronic condition and delirium is acute. Dementia is progressive and permanent, delirium wax and wane. How to differentiate dementia from normal aging? Some minor impairment in memory may accompany healthy aging, but the requirement that the memory impairment causes significant dysfunction in social and occupational life should exclude normal aging from the diagnosis of dementia. What is pseudodementia? Patients with depression-related cognitive dysfunction have prominent depressive symptoms, more insight into their symptoms than do demented patients, and often a history of depressive episodes. Common neurocognitive disorders: Alzheimer's disease, Pick disease, neurocognitive disorder with Lewy bodies, vascular neurocognitive disorder, normal pressure hydrocephalus. Amnesia is a major neurocognitive disorder caused by other medical conditions. They are marked by memory impairment in addition to other cognitive symptoms. The causes include medical conditions. Etiology: although the cause of dementia of Alzheimer type remains unknown, studies suggest as many as 40% of patients have a family history of dementia of Alzheimer type. Acetylcholine and norepinephrine, both of which are likely hypoactive in Alzheimer's disease. Treatment includes supportive therapy and pharmacological therapy, such as choline esterase inhibitors. Pig disease, frontotemporal neurocognitive disorder. The cause of pig disease is unknown. The early stages of pig disease are more often characterized by personality and behavioral changes, with relative preservation of other cognitive functions. Neurocognitive disorder with Lewy bodies. Lewy body disease is clinically similar to Alzheimer's disease, however, is commonly present with hallucinations, Parkinsonian features, and extrapyramidal signs. Vascular neurocognitive disorder. The general symptoms of vascular dementia are the same as those for dementia of Alzheimer type, but the diagnosis of vascular dementia requires either clinical or laboratory evidence in support of vascular cause of dementia. Vascular dementia is more likely to show a stepwise deterioration than is Alzheimer's disease. CT scan shows the evidence of infarct. Treatment is supportive. Memory loss, cognitive impairment, functional impairment are present in both, whereas dementia is a chronic condition and delirium is acute. Normal pressure hydrocephalus is a rapidly progressive condition where there is urinary incontinence, gait ataxia, and dementia can be seen. CT scan shows hydrocephalus and the treatment is VP shunt. Diagnosis of dementia is made from clinical examination, including a mental status examination and on information from the patient's family and friends. Mild cognitive impairment defined as the presence of mild cognitive decline not warranting the diagnosis of dementia, but with preserved basic activities of daily living.